Good morning, Grandad. Good morning. My name's Sue and we've got Ruth, Margaret and Ian. Grandad, we do need to put you onto another bed. It's a better mattress for you, okay? Now, are you alright with that?
I'm going to pay more of it.
No. So, Granville, we do need to slide you over onto this bed. There's no need for you to do anything at all. No need to worry, because we're sliding you over with using one of these slide sheets, okay? And we also have to put a hardboard underneath you.
There are several important things to take into account when performing a lateral transfer from bed to bed or bed to trolley. This includes a transfer of deceased patients from beds and trolleys. 1. Safety and comfort of the patient and the staff performing the activity. 2. The transfer is undertaken in a controlled manner and the fast snatch action should be avoided, as this feels like a fast fairground ride for the patient and puts staff at risk of injury. 3. The correct positioning of the transfer sheet is essential. And 4. Effective leadership of the move should take place. The patient should be tilted so that the transfer sheet can be positioned under them. Staff should assist in pushing the patient onto their side and towards the receiving staff, rather than staff having to reach over the patient to pull them onto their side. The sheet handles should be positioned so that all the stitched handle is hanging over the edge of the bed and the patient is lying on the remainder of the sheet. If there is insufficient sheet to fit under the patient, then they should be repositioned closer to the edge of the bed. The long handle position is important as it removes the need for staff to lean forward when undertaking this move.
Back, ready, go. Just going to turn this bit a little bit as well, okay? Just get the bed in first and then we'll turn and put that board in.
The bed should be positioned so that the receiving bed is slightly lower than the bed the patient is currently lying on, and the hand pendant should be higher than the patient's head to prevent injury to the patient during the transfer. Patslide board should be positioned under the patient but must still bridge the gap between the two surfaces. The patient's feet should be moved so that they are on the board before the move is started. Three staff should take hold of the long handles in order to pull, and the fourth person should start to push the patient onto the Patslide board. Once the first move has taken place, the person pushing should move to the bottom of the bed to ensure the patient's feet move safely across the gap. Sliding the patient in a controlled manner and in at least 3 moves means that if something starts to go wrong, the move can be stopped before any accident occurs. The most common issue is the transfer board starts to move during the slide. This is likely to be due to the fact that the board is not in the correct position and must be adjusted before the move can continue. At the end of the move, the patient should be in the middle of the receiving bed or trolley. If they're not in the correct position, then the transfer sheet can be used to slide the patient before it is removed.